Hey, my name's Jim Hefner. I'm a doctor of physical therapy, and I've studied pain and worked on patients with pain for 12 years now. And during that time, I even wrote a book on pain because I'm so fascinated by it. And the one thing that I keep going back to with my patients is that pain almost becomes like a habit once you have pain. So 2 or 3 weeks ago, I tweaked my low back, and there's still certain movements that I become apprehensive of, or I become fearful of, or I anticipate because my body's expecting it. And in that way, that's how pain develops this habitual nature where your body starts becoming very used to the movements that hurt, and you try to offload those or you brace for those even before you need to. And when you feed into that habitual aspect of pain, it's less about the tissue damage and more about getting those tissues moving kind of in all directions. Now, another aspect was that, I used to tell people, okay, you need to do this three sets of 10 repetitions once a day. Uh, and what doesn't work about that is that because pain has this habitual nature, we need to train these areas multiple times or almost make a new habit around the pain. So now when I tell people to do exercises, unless they're a hard strength type of movement, but if it's a getting out of pain type of movement, I say do these movements frequently throughout the day, 5 or 6 times a day. Every time you stand up, every time you are going to change positions, add in a few of these movements because we need to break the old cycle, the cycle that's full of apprehension, fear, guarding, gaining muscle tension, break that pattern and add in this new habit of how your back moves, retraining the old way that it used to move prior to the pain. So I used to try, someone's arm is limited in a certain way, so we would just train that one direction of movement. But what's most important is we train that direction, but then we teach the joint how to go through the full range of motion. And it's teaching it to go through that full range and regular practice on it. That is how we break down the habitual nature of pain, the apprehension of pain. So pain is habitual. It has this habitual nature where our body almost develops a memory, short-term memory for that pain. That's why it hurts to go into certain movements. And instead of trying to address or treat your pain just by doing something once a day, you need to incorporate a new cycle of movement or a new habitual way of moving so that you can break down the old pattern and build in a new one that your body becomes familiar and strong with in all different directions.